One, if not several, COVID-19 vaccines could be available by next year. Even wealthy countries are now facing an ongoing conundrum about their priorities. How will South Africa decide who is first in line? The Bhekisisa Centre for Health Journalism's Aisha Abdool Karim joins us with more on this. Now, Aisha, good evening to you. Thanks for your time. How many COVID vaccines could we actually see in South Africa next year?
Yeah, so I think, firstly, let's just start with a bit of background. We know that there are hundreds of potential vaccines being tested around the world, and we're expecting some of those trials to have results by the end of the year. So basically, some companies are planning to have a vaccine ready to roll out by the beginning to middle of next year. And that's because it needs to go through like process of licensing and making sure that it's safe after we've got the trial results. So where it comes into South Africa getting access to doses is, richer countries like the US can afford to spend millions directly procuring doses from pharmaceutical companies. And what South Africa has done instead is we're trying to, in addition to trying to deal with companies directly, we're also entering an agreement known as COVAX, which is trying to secure equal access to vaccines for poorer and richer countries to make sure that everyone has access. But basically, that agreement is trying to ensure that all countries start with 20%, enough doses for 20% of each individual country's population. In reality, experts in South Africa are saying that we should really only expect enough vaccines to cover maybe 3 to 5% of our population by next year, and hopefully with the rest of the doses coming in over 2022 or potentially 2023. So we're looking at a very small number of vaccines being available to our population initially, and that's just within the course of the next year, kind of.
There's obviously going to be a limited number of doses available. I mean, who would be the priority groups to receive the vaccine first? It's a complicated question.
Yeah, so obviously we know that if we're only expecting 3% of our population to have access to a vaccine or enough doses to cover that percentage, we need to be making some tough decisions about who should be first in line to get those doses. There is some international guidance coming out from the World Health Organization and another American group, which basically recommend that the first people in line should be healthcare workers. And those people should be the priority because that's, again, trying to sort of safeguard the healthcare system in the event that we do have another surge in cases or a second wave. We want to make sure that we have the healthcare workers protected. In South Africa, we sort of, when it comes after healthcare workers, who's next in line, we have a difficult situation because you want to make sure also that disadvantaged and vulnerable people are not being left out in that first sort of distribution wave that we're going to have when it comes to vaccines. So we're going to have to do a much more targeted approach and trying to make sure that communities are involved in making sure that they also get access. Some other priority groups that we're looking at are people who are most vulnerable and at risk of developing severe cases of COVID. So those are particularly the elderly and also people with underlying health conditions like diabetes or high blood pressure, because we know that they're at risk of higher mortality rates and also just more serious complications if they do get infected. So those are kind of the groups that we're looking at first. And then additionally, beyond that, would then be trying to target people who would be more likely to spread the virus, so your super spreaders who research has shown us is going to be primarily young people.
I mean, would we be able to get the vaccine to everybody who needs it, or do you think it's going to be difficult for us to do that?
So I think South Africa is in a particularly difficult situation when it comes to actually trying to deliver a vaccine to people who need it. Because, as I said, we're looking at targeting groups that are primarily adults because we know that children are at low risk. And in South Africa, we have a vaccination program, but it's for measles and TB vaccines, and that's mainly geared towards babies or very young children. So we don't have a system in place to try and get a vaccine to adults. And so a COVID vaccine would be the first kind of thing that we would try and target this population. Basically, when it comes to trying to deliver it, healthcare workers be the easiest to reach because we could target that rollout to hospitals and clinics. And then when it comes to the elderly, you could try and reach people in care homes, because again, we know those locations. But beyond that, trying to determine where are people with underlying health conditions and trying to roll it out sort of like a mass rollout to the general public would be much harder. We would have to develop an entirely new system in this country because we have never tried to roll out a vaccine in this way before.
Aisha, Abdool, Karim, thanks very much indeed from the Bhekisisa Centre for Health Journalism. Do appreciate it.